Welcome everyone to the Emedica F2 SJT Essentials for the FY2 Standalone program for 2025 entry. Let me introduce myself for those that haven't met me before. My name is Muhibbur Rahman. I'm a portfolio GP, which means I'm a GP with multiple roles. So I've got different clinical roles. I'm a part owner of my own GP practice. I cover 2 different community detox units, and I've held various other clinical roles over the years. My main role now is in education. So I'm the medical director of Emedica. I help to develop teaching programs and run teaching sessions to help doctors to progress their careers, but I'm also a consultant in medical education. So I advise and help different deaneries, different organizations with their medical education offerings for doctors at different parts of training. I used to be an examiner for the GMC and an invigilator for their PLAB Part 2 exam. I'm a current OSCE examiner on the panel of examiners for Liverpool Medical School. I sit on the NICE GP reference panel, one of the authors for the prescribing safety assessment, and our team has got a lot of expertise in situational judgment tests. So I actually wrote the first article about SJTs in medicine back in 2007, and then the first one about SJTs for foundation. And we've been teaching about SJTs since way back in 2007. And our team have now trained over 82,000 delegates. Right, so let's get straight into it. First of all, some key dates. So you've already submitted your application because the applications have closed. What are the other key dates between now and the offers? So the first one is that you'll find out if you've been longlisted on the 29th of January. And from the 6th February onwards, you'll be able to book a slot for the SJT. You'll be able to choose when you sit it between the 4th and the 11th of March. The results will come out on the 7th of April. And then between the 7th and the 11th of April is when you'll be able to actually book an interview slot. And then the interviews are the last week of April. And the results come out about a week after the last date of the interviews. But the offers for jobs don't come out until the 14th to the 16th of May for the first wave. And then there'll be a second and a third round of offers running up until the end of May. Okay, so those are some key dates to have for your diary. All right. So let's do an overview of the exam that you're going to do, which will determine if you get one of those interview slots. Because as long as you meet the basic eligibility criteria, the only thing that will make a difference to you getting an interview slot or not is how you score in the SJT. Your CV plays no part in whether you get an interview slot or not. So the exam lasts 45 minutes, and in that time, you're going to answer 20 SJT scenarios. Each scenario will have somewhere between 3 and 8 stems. So the number of subparts, if you like, for each scenario varies. Now, all of the questions in the FY2 SJT are only of one specific type of SJT. It's called a ratings SJT, but there are 3 subtypes as to what the questions can be framed as. What you don't have are any SJTs in the format that you'll see in the MSRA. Some of you might have, for example, also applied for specialty training alongside this. Okay, that uses a completely different type of SJT that has ranking SJTs and multiple choice or selection SJTs. There were none of those in the FY2 SJT. Okay, only ratings SJTs. But within that, there's 3 subtypes. The most common, almost all of the questions in your exam will be where you rate different actions. However, there may be some within that where there's a slight variation, where they have evolving dilemmas. So they have a first part, and then they add additional information, and then they ask you some more questions in an evolution, if you like this is what happens next to that same scenario. But the other type, which is slightly different, is they might have speech dilemmas. So rather than different actions, and is this an inappropriate or appropriate action to take, there might be, is this an appropriate or inappropriate thing to say? So it's specifically about what words you use. Okay. And when you get given any of these, as I mentioned, they're ratings SJTs, what you'll be asked to do is rate them from 5 possible ratings, from extremely desirable to extremely undesirable. So these are the possible ratings. For all questions in the FY2 SJT, these are the same possible ratings. So extremely desirable means this is a very appropriate thing for an F2 doctor to do, given this scenario. Slightly desirable, this is an appropriate thing to do, but it might not be ideal. i.e., it's overall more good than bad, but there may be some things that mean it's not ideal. Okay, it's overall more positive than negative. There may be some things that are neither desirable nor undesirable. So this is something that's not appropriate, but it's not inappropriate either. It's basically neutral, or it's just irrelevant to the scenario. It doesn't make any difference to the scenario, positive or negative. There are very few of these in the exam. Slightly undesirable are things that are considered inappropriate things to do, but they may not be terrible, i.e., they're more negative than positive, but there may be some positive in it. Because if there was no positive in it at all, it was absolutely awful, it'd be extremely undesirable, which is the last option. Extremely undesirable is either something that's very inappropriate, or it could be actively harmful, or it goes clearly against GMC guidance. Okay, i.e., there's nothing positive about this at all. It's just negative, right? So these are the 5 possible ratings. Now, if you've never done a ratings SJT before, this may be difficult to get a handle on until we've actually done one. So let's actually move on to do a scenario, because I think it'll become a bit clearer then. But before that, let me just explain how it's marked. So the FY2 SJT is marked using a near-miss marking scheme. So you get 4 marks if you get the answer fully correct. Okay, i.e., if a particular STEM, if that action is considered to be extremely desirable and you select extremely desirable, you can see you've got it exactly right. You get 4 marks for that. You get 3 marks if you're 1 position away from the correct answer. You get 2 marks if you're 2 positions away, 1 mark if you're 3 positions away, and you get 0 marks if you're 4 positions away. That's only possible if the right answer is extremely desirable and you answered extremely undesirable. You can see that's 1, 2, 3, 4 away. You'd get nothing for that. Or if the right answer is extremely undesirable and you ranked it extremely desirable, that's the only way you can get 0 marks. Or you didn't get to that question, you left it blank. You'll also get 0 marks. If you didn't answer a question, you get no marks for it. Okay. But other than that, you can potentially get partial marks if your answer is close to the right answer. The closer it is, the more marks you get. And you can get full marks, so 4 marks, if it's perfect, if it's the right answer. So just remember that the SJT is not testing clinical knowledge. What it's testing is your judgment and decision making. But there are some questions which do test knowledge of key guidance from the GMC and medical ethics. Ultimately, what they're assessing is your suitability to work as a junior doctor at the level of an F2. So what they do is they test against the professional attributes deemed to be positive traits, good characteristics for a good F2. So they're basically 5 core competencies or domains: commitment to professionalism, coping with pressure, effective communication, patient focus, and working effectively as part of a team. Now, each of these is broken down into lots of subdomains, and a specific question might be looking at a subdomain, a subpart of each of these. Okay. And then, as I mentioned, some questions may also test your knowledge and ability to apply GMC guidance from things like good medical practice, or GMC ethical guidance on things like confidentiality, respecting patients' wishes, capacity, things like that. So let's do a question, because I think once we've done one, it'll become a little bit clearer how the options work, how it's marked, and then we can talk a little bit more about how to prepare and where you go from here to the exam and what support we can offer you if you require additional support. Okay, so I'm going to show you a question. All right, and I'll give you about a minute or so to have a look at it, and then I'll launch a poll. Okay, here we go. We're just going to do one scenario, but with different stems today. Right, so brief session today. We'll try to finish the main teaching in half an hour, and then I'll allow 15 minutes at the end for any questions. Okay, so here we go. Okay, so I've launched a poll. Please select your answer. Okay, there we are, that's time. Select your answer. So while you're doing that, I'm just going to read through the scenario. One of the things I recommend you do in the exam is, do you see, this is one scenario, okay? This is the stem. You only need to read the scenario carefully the first time, because when we move to the next stem, this won't change, only this will change. And also the options, they're the same each time, right? Okay, so that first time you're reading it, read it carefully, try to picture the scene, watch out for keywords and think, why have they used that word? What could that mean? Think back to those domains and think, okay, I can see that this is testing primarily this domain and maybe this domain. And then when you're looking at the actual stem, again, you need to read that really carefully. Okay, so let's do a read through, because you don't have time to come back to these, all right? With the timing of it, you want to read through it once. So let me read through it and just highlight some of the key things that I would pick up, okay? So you can see, this is not about what you would do. This is an example of a third-party SJT. This is about what Yvonne should do in this situation. Yvonne is a junior doctor. In any of these scenarios, if it doesn't mention the level of the doctor, you need to place them as an F2, okay? So Yvonne is called to see Mrs. Evans, who's become unresponsive following a massive postpartum hemorrhage. So she's given birth, bleeding out. She's lost so much blood that she's lost consciousness. You can see this is a very dangerous situation, isn't it? Now, Mrs. Evans still has a pulse and she's breathing. So although she's unconscious, can you see that she's not in arrest? Okay. But remember I said try to picture the scene. Yeah. Although she's not in arrest, someone who's bleeding out could go that way, couldn't they? And you can see from the notes that she's got a valid advance directive. It's been signed. She's saying that even if my life is threatened, I do not want to have blood products. And this was confirmed as valid on admission. This is still what she wants. Now, Mr. Evans, so the husband, you can imagine, his wife's just given birth. Now she's bleeding out. He's worried she might die. They've just had a baby. So he's really very distressed. See, that's an important keyword. And he wants the doctor, Yvonne, to administer a blood transfusion to try to save her. So how desirable are each of the following responses for Yvonne in this situation? All right. So remember, this will always be the same, but this is the actual bit that you're reading. So let Mr. Evans know that, look, I'll contact the consultant for urgent assistance. So that's the scenario we're thinking about. So in terms of answers that people have picked, the two popular ones are extremely desirable and slightly desirable. So about 60% of you picked this. Just over 20% of you picked this. And then what's interesting, nobody picked this. The rest either picked slightly undesirable or extremely undesirable. So the correct answer, this is extremely desirable. Okay. There's a couple of things that this one's testing. So it's testing, first of all, patient focus. You can see that this is a life-threatening situation for the patient. So you're thinking about the patient. It's also testing, though, part of coping with pressure is knowing your limits and working with the team, right? Knowing who's the right person to contact in which situation from your team. Can you see that this is a potentially life-threatening situation? But beyond that, it's quite complex because of the fact that the husband wants you to give blood, but we know that there's a valid advance directive, i.e., the lady who's bleeding out doesn't want blood. So would you all agree that this situation is far too complex for a doctor in F2 to try to deal with on their own? Yeah. So just see, by recognizing that getting someone senior, and the consultant's the most senior person on the team, that is something sensible to do, isn't it? But there's also an urgency because of the fact that this is potentially a life or death situation. And so, letting the husband know, he's asked the doctor, look, can you do this? Letting them know, look, I'll tell you what, I'm going to contact someone really senior urgently for help because this is really complex. That's extremely desirable. It's a very sensible thing. It's entirely appropriate for an F2 doctor to do this. So if you picked extremely desirable, you get 4 marks. Now, do you see what near-miss marking works? So if you pick slightly desirable, because you're 1 away, you'd get 3 marks. Nobody picked this. If you pick slightly undesirable, which a few of you did, you'd get 1 mark. Interestingly, more than 10% of you picked extremely undesirable. You'd get no marks for that because that's 4 away from the correct answer. Okay. Right. So when we move on to the next one, I'm not going to give you anywhere near as much time because the scenario is not going to change. The options aren't going to change. Just this bit, the stem will change. Remember, for any given scenario, there could be as few as 3 stems, as many as 8 stems. Okay. So when we move to the next stem, I'm just going to give you about 15 seconds. Okay. Here we go. Okay. So this time, tell Mr. Evans that there's nothing else that can be done for his wife. So that's the action that we're considering, that, how desirable is this as an action for Yvonne to take in this situation? Okay, so I'll stop you there. Most of you have picked extremely undesirable for this one, and that's the right answer. This is extremely undesirable. And that's because it's, first of all, it's just not true, is it? It's one thing to explain to Mr. Evans that, what you're going to do and what you're not going to do, but to say there's nothing else that can be done. Let's say that this patient continues to bleed out and they're going to arrest. Just because someone's declined blood products, it doesn't mean you can't give them CPR. As a junior doctor, you can escalate by letting someone senior know. You see, there are things that can be done. And so it's extremely undesirable because it's untrue, but also quite subtly there's a difference between explaining something and telling him. He's very distressed. So just to tell him that there's nothing else that can be done, that's not true, but it's likely to lead them to become more distressed. Okay, so there's nothing positive about this. It's extremely undesirable. So if you pick that, you get 4 marks. If you had slightly undesirable, you'd get 3. Nobody picked this, nobody picked this. Some of you, though, picked slightly desirable. You'd only get 1 mark for this question for that. Okay, let's move on to the next step. While you're selecting your answers, so here, the scenario is hand Mr. Evans the medical notes and tell him to look at the advance directive. So remember, she's signed this thing to saying, look, even if I'm bleeding out, even if my life is in threat, I do not want to have blood. And it's signed, it was confirmed as valid when she was admitted. Okay. So correct answer here is that this is extremely undesirable. Can anyone think why? And again, most of you picked this, so well done, but quite a few of you picked either slightly desirable or neither desirable nor undesirable. So you can see how that would be marked there. But why is this extremely undesirable? Well done. It's a breach of confidentiality. Okay. If we look at the GMC guidance on this and what it says about confidentiality, that if you're going to disclose personal information without consent, you have to be satisfied that there's a legal base for breaching that confidentiality. Just because he's the husband doesn't automatically give any right to look at someone's notes. Okay. And there might be some situations where you've got a legal basis for breaching confidentiality. For example, if you've got a court order to hand over someone's notes because they're involved in a case and it's relevant, well, we have a duty to obey the law. If you've got a patient who has got a notifiable disease, you have a duty to tell a consultant in public health so they can do contact tracing and try to minimize the spread of infection so that it doesn't become an epidemic, which could then later on become a pandemic, right? Okay. So there are some situations where there's a legal basis for breaching confidentiality, but this isn't one of them. Okay. And so this would be an inappropriate breach of confidentiality, which is why it's extremely undesirable. Now, let me ask you a question. Is there anybody that thought that this is absolutely wrong because this is a clear breach of confidentiality, but didn't pick extremely undesirable because you felt, I've used that up because that was the right answer for the one before, right? Remember? For STEM B, the correct answer was extremely undesirable. Is there anyone that actually thought that's what fits this scenario, looking at it, but just thought, I've used that one up, and so I'm not allowed to use it, or thought they wouldn't put two in a row of the same, they're trying to catch me out, and although you're drawn to this, you then change your mind and put one of the others? Is there anyone that did that? Yes. Okay. More than one person has probably done that. So the first thing is, you just might not have known how ratings SJTs work. Each STEM is a separate question, okay? So although the scenario hasn't changed, can you see this is C, this is separate to A and B. You pick whatever fits. You can use the same option once, more than once, or not at all. Some of them you might not use at all in a given scenario. Some of them, if all of them are extremely undesirable, A, B, C, D, E, then pick extremely undesirable for all of them. You pick what fits. Now, so part of that might be that you just didn't know, and that's okay. You're here to learn. It's a relatively new exam. You may have no experience of a similar type. Even if you've done SJTs before, like for the MSRA, this is completely different. Because, for example, in the ranking type of questions in the MSRA SJT, you can only assign one rank once, i.e., if you put one of them as the best, you can't put another one is also the best. You have to rank them first, second, third, fourth, fifth. That's not how it works for the ratings. You just pick the rating that fits. Okay, so there's knowing that part. And then the second thing is that don't sort of overthink and think, oh, they're trying to catch me out. Don't go down a wormhole of a conspiracy theory. They wouldn't put two of these in a row or three of these in a row. Pick whatever fits the situation. Okay, good. Let's do the next one then. So this is D. Okay, so D, the action is continue to monitor Mrs. Evans' vital signs, i.e., still got a pulse and is still breathing. So you could monitor what's the respiratory rate doing? Have they still got a pulse? We could check the blood pressure again. Because someone can be unconscious, but if they continue to bleed out, they could be at risk of going into peri-arrest and then going into arrest, right? So continue to monitor is extremely desirable. That's a really sensible thing to do. Because if they do go into arrest, the sooner that you can put an alert out and get a whole team around you, the more options you're going to have. Okay, so this is extremely desirable. Something else to be aware of for a ratings SJT, as I mentioned earlier, that each STEM is separate. So don't think that, oh, this doesn't solve the whole problem. It doesn't need to. You need to look at, is this action got any negatives to it? This doesn't mean that you can't also get help from the consultant, another option that we looked at earlier, okay? They're just separate things. You've got to look at each one separately. You're not comparing one to the other, okay? Okay. Okay, so this action is administer a blood transfusion in Mrs. Evans' best interest. Okay, so the two popular answers here were extremely undesirable and slightly undesirable. And one person thought it was neither desirable nor undesirable. Nobody picked extremely desirable or slightly desirable. Okay, that's good. So the correct answer is extremely undesirable. And do you remember I mentioned earlier that for some scenarios, while they're not testing clinical knowledge, they may test your knowledge and your ability to apply GMC guidance. So if we look at the GMC guidance on this, that you've got a duty to respect a competent patient's decision to refuse an investigational treatment, even if you think this is wrong or you think it's irrational. And actually, the specific example they gave you relates to this, that some Jehovah's Witnesses have strong objections to the use of blood and blood products and may refuse them, even if they may die as a result. That's exactly what's happened here. This patient has said that they do not want blood. Now, that might be because they're a Jehovah's Witness. We don't have information on that. But what we know is that it's a valid advance directive. It's been signed. They've said that they don't want blood, even under threat of life. And that's what's happened. Okay. And so you cannot override that. Not only do you have a duty to respect them, but actually to administer blood to someone who said they don't want blood would actually be considered an assault in the UK. All right. So this is extremely undesirable. Right. There is one more actually. Here we go. Okay, great. So the action here is to tell Mr. Evans that he should contact the chaplaincy service for support. Okay. Now, this one, there's a much bigger spread of answers. So the spread between extremely desirable to slightly undesirable. No one's put extremely undesirable. The most popular answer is that it's slightly desirable, followed by that it's neutral, neither desirable nor undesirable. So the correct answer is that this is slightly desirable. Why is this slightly desirable? Remember, what did we say first of all? What does slightly desirable mean? That it's an appropriate thing to do, but it might not be ideal. There may be some negatives to it, there may be some positives, but there's going to be more positives than negatives for it to be slightly desirable. Because if there were more negatives than positives, it would be slightly undesirable, right? So what could be the positives of Mr. Evans contacting the chaplaincy service? Anyone know what the role and function is of a chaplaincy service? So chaplaincy service in a hospital, typically there may be people from different faiths involved in the chaplaincy service, and they will be able to offer support. So for example, in this situation, it might be that the declining of the blood products might be to do with their religious beliefs. And so the chaplaincy service can offer support where there isn't someone specifically for a given religion. So you'll often see a lot of the bigger hospitals in the UK, they will have, within the chaplaincy service, they'll have someone that's working there that will represent most of the major faiths. Okay. So they can put you in touch, for example, with a pastor or a priest from the Church of England or Roman Catholic, an imam for those that follow Islam, a rabbi for those that follow Judaism, and so on. But they'll have contact details for others. So they may be able to put someone in touch that wants to talk to someone that follows their own faith. But also there might be people who follow no faith, but that would still benefit from having support from someone who may be able to talk to them, may have time to listen to them. They can raise some of their concerns, but also to offer sometimes if they just want, they're very distressed at the moment, to have a quiet space. Okay. Why might it not be extremely desirable? Are there some things about this that are not ideal? So, there may be many things what they might benefit from. There's definitely some positives there. Why is it not extremely desirable? Remember, extremely desirable means there's not really any negatives about it. It would be an ideal thing to do. Well, right now, their wife's bleeding out. They might not really want to leave the ward. They might not want to go elsewhere. It might be also the fact that here, the word tell, each word can sometimes have a meaning. The word tell and the word should means that this approach is a bit doctor-centered. It's saying that they have no choice. You should do this. Whereas what might be better is explain to Mr. Evans that he can contact the chaplaincy service for support if he thinks he will benefit from it. Do you see the difference? Okay, so sometimes that one word could make a difference. So this is slightly desirable. Okay, so what I want you to do is add up your total from the questions that we've done. And I'll just launch a poll to see the spread of answers. So just pick from A, B, C, D, E. How many points did you get in total across all of those stems that we did from that one scenario? So in the exam, can you see that you're going to have 20 scenarios like that? That's just one scenario we've done. We'll have 20 scenarios. Some will have more stems than this. It can go up to 8 from one scenario. Some will have fewer. It can be as few as 3. Okay. What's more common is 5 or 6 is quite common for a lot of them. Okay. So from those that have put a score in today, just under half of you are somewhere between 21 to 23. About 40% of you are at 24. The rest are in this band. Okay. Now remember that this is not a simple pass-fail exam. It's competitively ranked. Okay. Even 1 mark could be the difference between you getting an interview or not getting an interview. Okay. They just take the top so many. We're going to talk about that now. So do you see in that question, knowing about the GMC guidance on how to deal with advanced directives would have been useful. So what's the core knowledge? What kind of things is it worth gaining the knowledge of? You want to learn about the biomedical ethical principles: autonomy, beneficence, non-maleficence, justice. When you can and can't breach confidentiality. There was an element of that in one of the stems, right? Understanding capacity, including the difference between Gillick competence and the Fraser guidelines. Consent, and how Montgomery has impacted the Bolam and Bolitho test, the updated guidance in GMC 2024, the key duties of a doctor from the GMC, and key ethical guidance on things like child protection, end-of-life care, including the Tracy case, personal beliefs and medical practice, both patients' personal beliefs like this, but what a doctor's personal beliefs might impact the situation. Like what if a doctor strongly is against termination of pregnancy and someone comes requesting a termination? How should a doctor deal with that situation? Raising concerns, prescribing, maintaining boundaries, social media, financial issues like when you can and can't accept gifts. Okay, because you see what the SJT does, it asks what a good doctor should do. So there might be some things that you've never encountered yourself, but they might still test that you should know what does the GMC say a doctor should do in that situation. So some questions will test knowledge of key GMC and ethical guidance. And so revising that core knowledge before the exam can be one of the things that can help. Okay. So what I'm going to do is I'm actually going to talk about how to prepare, and then we'll take questions at the end. So the first thing is it's really important to know each of those domains, the subdomains, right? Because then you can see in a question, okay, I can see this is testing, coping with pressure, and within that, one of the subdomains is knowing your limits. Working well as part of a team. Part of that is knowing the roles of different team members and knowing who to ask for help in which situation. This was complex medico-legally as well as life or death. So getting someone senior would probably be more sensible than getting, say, another F2. Read and get familiar with the updated Good Medical Practice, which was updated in 2024 with some significant changes. Read the core GMC ethical guidance on the topics that I mentioned earlier. And then you want to practice FY2 ratings questions specifically, because they're very different and the approach to them is very different to other types of SJT questions like the MSRA SJT, which doesn't have ratings questions in it at all. Okay. So in terms of useful resources, the official foundation program has a small selection of FY2 rating sample questions on the UKFPO website. You could look at FY1 questions, which do have a slightly different format. Okay, you could read the SJT monograph, which includes the details of what do the domains and the subdomains mean. You definitely want to have a good understanding of Good Medical Practice 2024. could use good medical practice in action, which is on the GMC website. It has some examples of different scenarios which have ethical dilemmas in them, and you can sort of work through how you would deal with it. And then to learn the core GMC ethical guidance. Now, the support that we can offer, we have a full day SJT course dedicated to the FY2 SJT. As I mentioned, it's very different to MSRA one. We run a different course for the MSRA SJT. It's completely different questions, okay? But this is dedicated to the FY2 SJT. We only run it once a year. So for this year's exam, it's running on the 8th of February. It's going to be live and interactive via Zoom. We will cover the key theory and the key ethical guidance in depth. So, all of those topics that I talked about that it's worth learning, you can go and read them yourself and then try to understand them. But if you want to learn them quickly and efficiently, we'll cover all of that on the day. We'll also cover exam technique for ratings SJT questions. We'll cover all 3 ratings SJT types. So you'll see the standard type that you saw there, actions. You'll see evolving dilemmas. You'll see speech dilemmas. We will do a full teaching FY2 mock SJT where we'll get you used to the optimum timing, but then we will go through a detailed discussion of every single STEM and every single scenario. You'll also be able to request access to the recording of that for a month afterwards. You can go over it in detail. You'll get access to a full online SJT mock. So we have a full FY2 SJT mock in the same format as the exam, with timed version and an untimed version. And all of the questions on both our course and our SJT mock are specific to the FY2 ratings format. So you're not going to spend any time doing things that are not relevant to you. We're not going to be doing things that are for a different type of exam. It's specific to the ratings SJT that you're going to do. So you can find details here on the Emedica website. I'll show you where to find it on the website as well, actually. So if you go to our website, which is emedica.co.uk, you can see here FY2 SJT, and here's details of the course, okay? So as I mentioned, the course is running on the 8th of February. The standard price is £250. However, if you book by the end of January, so by the 31st of January, you can save £55. It's £195. That's the early booking discount, basically. It's automated. You don't need to put any code or anything like that. That's the price as long as you book. From the 1st of February, anyone that books from then on, it will go back to the standard price, which is £250. Just to give you an idea, we ran this course last year, and here's some of the feedback from people that used Emedica last year. So Dr. AR here scored 450. They got an interview, and they particularly found that, this is their words, that they felt they couldn't have done this without the guidance in the course. Here's someone that did our mock. They got 433, and then they had the interview and did well there. This person ended up scoring 435 in the SJT. That's a really good score. They got an interview. And beyond the course, they didn't have time to do much else. And that's because they were writing their PhD thesis. So they're really busy with that. But I think this bit's really, really important, what they said, that they think the course was extremely effective in prepping them for the exam and delivering the key information in a concise manner. In one day, they could cover all the key things they needed. Yes, you could read all of these things yourself, but if you're busy like this person was, it might take you 2 or 3 weeks to do that. We've already done all of that and made it concise and easy to understand, and we give you examples so that, and you can ask questions, and it's interactive, okay? Here's someone else, they managed to get a slot for interview because they were busy with something else. They were busy preparing for their PLAB Part 2 and were really working hard on studying for that. They had very limited time. We've had people that only had a few weeks, okay? Here's someone else that they found it to be extremely helpful. They only had a week to prepare because they were busy with other things. What they found was that not only was it informative, but it was concise and it helped them to understand how to rank resources. And they found the exam was useful to give them an idea, where am I? And then the actual exam seemed easier because our questions are hard, okay? So just a reminder, that's where you can find the course. And just then, what happens after you've done the exam? You basically will be ranked alongside everyone based on your SJT scores only for shortlisting. They then will take the top scores and invite them to interview. They do this at a ratio of 3:1. So I'll give you an example. Let's say this year there's 250 jobs. They haven't published how many jobs there'll be yet, but just to give you an example. Let's say there's 250 jobs. it means that they will interview 750 people if there's 250 jobs. But there might be 1,500, 2,000, who knows, candidates that apply. So it's not just about, there's not a pass-fail for the FY2 SJT. It's about getting the best score possible so that you get that interview slot. Once you get to interview, your SJT score doesn't matter at all. Okay? The only time it would matter is if two people had exactly the same interview score, then they might use the SJT as a tiebreaker. But essentially, it doesn't carry a percentage weightage in your rank after. It's the only thing that decides if you get an interview or not. Okay? Once you get an interview, it's your interview scores that will decide your ranking to decide if you get a job offer or not. Okay? So, it's not a pass-fail exam. It's competitively ranked. Lots of people will do well, but if other people do better, they're the ones that are going to get the interview slots, because only the top scorers will get an interview. So you just want to focus on getting the best score possible, all right? And the SJT, while there is that core knowledge you need, it's not just a knowledge exam like a lot of clinical exams are. A big part of doing well is exam technique. Part of that is learning how to manage your time. Part of that is learning how to map questions to the domains quickly, picking up keywords, understanding how to approach ratings SJTs and how that's different to other types of questions. So, and focused preparation and practice can definitely boost your scores, because we had people last year who the year before had applied and hadn't done well at the SJT, not well enough to get an interview. They found that they significantly improved their scores and their approach and understanding, got an interview and got a job. They're now they'll be finishing soon, okay? And, going into the next phase, will have been applying for specialty training. And I leave you with this, and then we'll take questions and wrap up. From Abraham Lincoln, that if you've got 6 hours to chop down a tree, you would do well to spend 4 hours sharpening your axe. What does that mean? That if you know that, look, I've got this hard task to do, if you have the right tools, and those tools are in a state of preparedness, because you've got a sharp axe, you can chop the trees effectively, efficiently, quickly. So similarly, if you have the right preparation on the day, it will be much easier than if you don't have the right preparation, and a lot of this stuff is new to you. Okay. So for those that haven't got questions, what I'm going to do is say, look, I hope you found today helpful. Hopefully you've got a clear idea of the exam and what to expect. And if you can do it on your own, great. Whether you take up our support or not, I wish you all the best. Our whole team wishes you all the best with both the SJT, then the interview. Ultimately, prepare and you will succeed. For those that would like support, we've got the full day course that includes access to the mock. The mock is also available for people that just want questions. We also offer, after this stage, support for the interview, specific to the FY2 SJT format. Okay, so you can get in touch after you've got in to find out more about that. So thank you very much. What I'll do now is I will hang about and take questions for anyone that has got questions. Someone's asked a question, how many times can you do the mock? Once your subscription is active, so remember you get access for a month as part of the booking, you can do it as many times as you want. Okay. Someone's asked about details about the mock. So the mock that we'll do at the course, it will be a time teaching mock. So we will get you to get used to the optimum timing. Then the online mock that we offer as part of this, that you'll have access to afterwards, that's completely different questions. Just like the real exam, it will have 20 SJT scenarios with a range of between 3 and 8 stems. In total, there's 120 stems, 120 bits, similar to the real exam. Okay, and the format, the screen format, the marking is all like the exam. Okay, great. That's the last question. Just want to say thank you very much. I hope you found it helpful. Hopefully you've got a much clearer idea now about the exam, and you can get started with your preparation and know what to do from here.